Another big fear I hear, will my child get addicted to the medicine? So,
Yes.
what I like to talk about is that what has actually been shown is that children who have ADHD and that go untreated are actually more likely to have problems with substance use and addictions and things like that because they are looking for the thing that to help them.
Welcome to Thriving with ADHD, a podcast where we'll share everyday practical tips to thrive in life as an adult with ADHD. This podcast is brought to you by Animo Sano Psychiatry, a behavioral health practice with a specialist ADHD clinic based in North Carolina. And this is your host, Nada Pupovac. When a child is diagnosed with ADHD, one of the first and often most overwhelming questions parents face is, what's the right treatment? Should we try medication? Is psychotherapy enough? Or is a combination the best approach? With so many information online and strong opinions on all sides, it's easy for families to feel confused, anxious, or even pressured into decisions. Welcome to a new episode of Thriving with ADHD, dear ADHD community. This month's episode is about cutting through those misconceptions and offering clarity, balance, and reassurance around ADHD treatment options for children. Joining me for this important conversation is Dr. Karen Melendez, clinical advisor and supervising physician at Animo Sano's Child and Adolescent Psychiatric Clinic. Dr. Melendez leads pediatric and adolescent services at our practice, recognizing how early experiences shape emotional development and long-term well-being. Her compassionate leadership, clinical expertise, and commitment to collaboration make her an invaluable advocate for children, adolescents, and families. Dr. Melendez, thank you so much for joining us today. I'm looking forward to your insights, especially as we talk through realities of medication, psychotherapy, and how families can make informed and less fear-driven decisions when supporting a child with ADHD. So, a warmest welcome to our podcast.
Well, thank you so much for having me. I really appreciate the invite and the opportunity to speak on this very important topic.
Absolutely. So, when a child is diagnosed with ADHD, many parents feel overwhelmed, which is understandable. So, what are the first steps that you can typically recommend for understanding which treatment option might be suitable? Medication, psychotherapy, or both?
Well, I think this question is so important because it really um, gets to the heart of what that initial evaluation and establishment of a relationship with a provider is for families, right? Families want to be able to feel that they can trust their provider, that their provider has their and their child's best interest at heart. And I really look at that as a privilege, right? That this
Mm,
family has decided to come and sit in front of me, whether it be in an office or via telehealth,
yes.
um, to invite me into their home and to problem solve a dynamic within their family structure and something that has arisen as an issue that needs to be looked at and dived into. So for me, I think it starts there. It starts with a frank conversation. It
Mm,
starts with a good and thorough evaluation, because it's not just about ADHD. You really want to understand what stressors the family is under, what stressors that child is under, what does that child's or that adult's day-to-day life look like.
mm.
So I think that's where it starts, and that's where the decision making and the trust building and the rapport building starts. And then we can look at Is it medication? Is it psychotherapy? Is it both?
Mm,
Um, in addition, during the evaluation, it's important to find out what other family members are also diagnosed with ADHD and what has worked for them. So
mm,
really starting from that, it's such a, genetically based condition,
true,
right? And
true.
it's so well studied from a child and adolescent psych standpoint, but also a child neurology standpoint, extremely well studied.
Mm-hmm.
So when you look at those things and and so many people are diagnosed with it, right? At least 3.5 million children in the US
Okay.
have some form of stimulant treatment or what have you. So given that, I think it's important to really dive into who else in the family is being treated, what's worked for them, because historically I have found that if there are first degree relatives that are having success with a certain medication or treatment modality, it's usually going to work for the child as well.
Oh, excellent. Now that you're talking, some in some previous episodes, we were also talking about actually parents not being aware that they have ADHD. I think this is usually with moms with inattentive
Mm-hmm.
ADHD who were diagnosed thanks to their child being diagnosed. So that this is the case as
Right.
well. Yes, so it's very interesting. But I think what you just said is reassurance to the parents that if they know they have ADHD and what works for them might actually work for their child as well. So I think this is important um, point. And
Yes.
you touched on stimulant medication and you mentioned it briefly. So I want to expand on that. And because there's a lot of misconceptions about stimulant medication. So um, what do you wish more parents understood about how ADHD medication actually works in the brain?
Right. So I think, when you hear the word stimulant, right, there's so
Yes.
many things in our culture that are stimulating, right? You think of, potentially like energy drinks, right? They're
Mm-hmm.
stimulating.
I know,
You
I
think
know.
of, you think of, illicit substances that can be stimulating as
Yes.
well. So when you hear that, when parents hear that, they're like, why am I going to give my child a stimulant? And let alone when my kid's already hyper enough. Why do I need to stimulate them any further? And it's actually the opposite effect for a child that's hyper or, inattentive or what have you. It's like a calming effect to the brain because the what stimulants do is through neurotransmitters, dopamine and norepinephrine, they are able to affect the reward pathways in the brain. They're also able to affect the executive functioning areas of the brain. So, in fact, the Washington University School of Medicine in St. Louis, there is an article, an amazing article that just came out and was published. I think it was December 25th that it came
Mm-hmm.
out. And it talks about how the stimulants there's just many more areas of the brain that it's affecting that haven't really been reviewed and that we haven't really been made aware of as well.
Mm-hmm.
For example, sleep. That stimulants for that ADHD person who hasn't had a good night's sleep the night
Mm-hmm.
before. It helps it helps with that focus and attention and able to make up for that lack of sleep and able to help them perform better. So that stimulant helps there. In
Mm-hmm.
addition, it helps with being able to have a bit of reward and a little bit of satisfaction feeling of satisfaction, even when the task is mundane, something that they don't really enjoy doing. And
Mm.
we all know that's one of the cardinal symptoms of ADHD, that it's very hard, like, unless someone likes the subject or likes the topic, It's
Mm.
very hard to engage and focus on it.
Yeah. Yeah.
So, working through those dopamine reward pathways, stimulants help with that as well.
That's really, really good to know. Thank you. I would like to continue this story with families hesitant about medication. I appreciate that, and thank you for sharing more about stimulants and how they work. But for those people and those families who are hesitant about introducing medication for their child, what are the signs or situation that indicate that psychotherapy alone might not be enough for their
Mhm.
child? Mm.
So, when you look at just psychiatry in general,
Mm.
and if you looked at our psychiatric Bible, the DSM-5, the Diagnostic and
Yes.
Statistical Manual,
Yeah.
right? And you look at it and you say, wait, I have a little bit of this. I have a little bit of that. We all have a little bit of this, a little bit of that.
Mm.
Okay. We all have
Yes.
certain traits, certain things. When it becomes disorder, is when it is affecting functioning. If it's affecting functioning in school, functioning at home, functioning in social situations, relationships with friends, what have you,
Mm.
if there is a child that, despite being in therapy 3 to 6 months, continues to get in trouble at school, continues to have difficulties at home, is always on restriction or
Mm.
or having to be redirected or disciplined in some way. That's when it's time to consider medication. What I like to tell parents is this: if I said your child had diabetes or asthma,
Mm.
would you tell me no?
Yes.
Would you tell me no? If I said, this is the evidence, this is your child needs insulin, your child needs albuterol, this is the evidence-based treatment for
Mm.
this condition, just like we have the evidence-based treatment for ADHD.
Yes.
And when we do look back at studies, in fact, the American Academy of Child and Adolescent Psychiatry does have a review on their website, and they did a systematic review of several studies.
Mm.
And really, medication comes out on top
Yeah.
as far as ADHD is concerned. That's why ADHD is one of those conditions that crosses over between psychiatry and neurology. You will find child and adolescent neurologists who are
Yeah.
treating ADHD, and that's just what they do because it
Mm.
truly is a neurological based disorder.
Yeah. And I know there is a stigma attached to ADHD, but hopefully, with each and every conversation that we have, including with you, people do realize this is the fact for the condition.
Mm-hmm.
So, and thanks for sharing that. And hopefully, this will reassure at least some of the parents that this is in fact happening with your child. So, but we are all for, of course, for a comprehensive approach
Mm-hmm.
to the treatment. So, could you help us distinguish between behavioral challenges that psychotherapy can address, and then some neurological symptoms that maybe medication might support better?
Yeah, absolutely.
Yeah.
So I would say that there's definitely behavioral challenges that can be associated with ADHD. Historically, maybe some oppositional behaviors, impulse. There's a lot of impulsivity, which, yes, medication can definitely help with impulsivity as well.
Mm.
But I do think we all need to support our schedules in some way, right? And there's
Yes.
certain things that work for people. For example, some people need visual reminders of things,
Mm.
right? Some people need alarms set on their phones or alarms to remember to do something. Um, I do think that the psychotherapy piece of ADHD treatment
Mm,
Truly needs to focus on what in the family structure and family schedules. It's this team effort that needs to
mm,
happen in order to best support this child. And the things that are being asked or that would help support the child are not are not things that would be that are out of the realm of let me rephrase that. There are things that are going to benefit everybody in the family.
okay.
Like structure benefits everyone.
Mm-hmm.
Helping parents understand how to approach, example, a messy room in the house.
Mm,
The patient's bedroom is completely a wreck. And every day there's an argument about this. Why
mm,
haven't you cleaned your room? You need to
mm,
clean your room. The kid's sleeping on the little sliver of the bed. The clothes are all over the place.
mm,
Mom, dad don't even know which is the laundry, which is not, what has to
mm,
be done. Um, and I think a therapist can help break down and give tools to
mm,
parents on understanding, okay, how do we make it easier? What can we do? How do we, for example, can we ask the child, or can we grab, 4 or 5 bins,
mm,
put them in the child's room, label each bin, your toys go here, your dirty clothes go here. And then when you're walking into the room, right? I know I would feel overwhelmed. Like, where do I
mm.
start? So, how do
Yes.
we partner along with the child? You're teaching them as you're helping them to
Mm,
get the room organized, right?
mm, mm.
Can we say, just work on this corner? Here are the 5 bins. If you have to like manually tape it off. This is the corner of the room. Let's organize everything, just this
Yeah.
corner. Let's start there. You have to, I think those are the kind of things that a therapist can help with. In addition, I think the therapist is a wonderful person to be able to communicate with the school as well and
Yes.
partner with the family to provide supports for any school issues that are
Mm,
occurring, any accommodations that may be needed.
mm.
Really being able to advocate for that child and partner with the parent to do so.
Excellent. Yeah. So, can you walk us through? I think you touched a bit on this by depicting the child's mess room situation, but could you walk us through a real life situation with this balanced multimodal treatment approach where parents combine psychotherapy and medication and how it looks like for a certain child? Maybe you can give example from a practice, of course, skipping the personal data.
Identifiers.
Yes, yes, yes.
No
Keeping
identifiers. No,
yes, no
absolutely.
identifiers, but just a typical example, maybe.
Well, I mean, a typical example that I've encountered is a child who, um, newly diagnosed with ADHD.
Hmm.
They're coming to me already having had some school troubles and school concerns. Um, Teachers, of course, willing to fill out all of the screeners and rating scales to land at the diagnosis, so they're fully aware that, hey, the parents are doing what they need to do to try to figure out and problem solve what's going on for their child. Um, and I think that the multimodal treatment approach is from various angles, not only partnering with the school, partnering with the therapist, but also partnering with your medication prescriber and whoever that may be. That may be a psychiatrist, that, like I said, it may be a neurologist, it might be a pediatrician.
Mm,
And going along with that, being able to also look at sleep hygiene,
mm,
nutrition, physical activity. Um, what is our family schedule like? How many things do we all have to get to, right? How many children are in the household and what activities are they involved in?
Yes, yes.
And what kind of space does that child need to help them focus? Do they do best in a quiet setting, away from the other children? Do they benefit from calming music in the background? What exactly, or do they benefit from come home, get off the bus, rip and run for an hour, hour and a half
Mm,
outside, and
mm,
then come in and get ready to work? I think those are the types of things that I like to discuss with families,
mm,
and really also, and so that's when I said earlier that there's nothing about ADHD treatment that wouldn't benefit aside from medication, right? We're not medicating
mm.
the whole family. I'm just saying that the things that we recommend, um, the things that we recommend, as far as structure, really looking at where the how the family functions best,
Mm,
nutrition, sleep hygiene, those
mm.
are all things that would benefit the family as a whole. Who
Yeah.
isn't recommending who isn't recommending lower processed foods, less sugar, more whole foods, lean proteins, veggies, fruits, whole grains,
Mm.
these complex carbs? These are all things that are being recommended for multiple things. We've seen how much inflammation can
Yes.
affect
Yes.
our mind, our brain functioning. So why not? And it affects several systems for us, right? Several of our physical systems. So why not recommend it for the family as a whole, and something that you all do together, so this child does not feel singled out,
Mm.
and instead it's a true partnership, and it's a true support system for that child.
I love that. I love that. And you're right. And I think even if there is anyone listening and you don't have ADHD, I think this still applies. Like
Yes.
building healthy habits
Mhm.
would benefit you
Absolutely.
overall. So,
Yeah.
uh, before I move to some closing topics, I would just like to go back to medication and discuss it a little bit more. And if you could share some common fears that parents have and that they express when starting the medication, and how is it that they can stay informed and less anxiety driven when making specifically medication decisions for their child.
Okay, so definitely some of the fears that
Mhm.
come up is, oh, my child, I've heard that it'll make them lose a lot of weight,
Ah, mhm.
or they won't be as tall as other children. So how I like to reassure people is to say we are going to be taking vital signs, meaning blood pressures, heart rate. We are going to be tracking their height and weight. If we start seeing any trends that it's not the right fit, we can always try other medications. There are plenty of choices. There's not only
Mm,
stimulants, but there are non-stimulant options as well that we can try. Another big fear I hear, will my child get addicted to the medicine?
ah,
Addiction to the medicine. So,
yes.
what I like to talk about is that what has actually been shown is that children who have ADHD and that go untreated are actually more likely to have problems with substance use and addictions and things like that, because they are looking for the thing that to help them. So
Mm,
it ends up being a self-medication situation.
yeah.
So um, I think it's really important to understand that untreated ADHD, there have been numerous studies connecting and showing that there can be some really scary consequences down
Yes.
when this condition remains untreated.
Yeah.
And so knowing that, now that we have these decades
Mm.
of studies, decades of successful treatment of ADHD, it's really important to listen to our patients, listen to their fears, but also be able to let them know that we're going to monitor closely. We're going
Mm.
to listen to you if a potential side effect arises, and then we'll make those decisions at that moment
Yeah. But in partnership and together with
in
the patient.
partnership.
Exactly. 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 And yeah, and thanks for sharing those. Do you have any advice? Of course, kids are growing up and adjustments are needed. So, any advice in terms of dosing, psychotherapy styles, support in school? As child grows, the needs will change as well. So, how it is that the treatment can stay effective as they go into adulthood?
Yeah, so I think it's important to note and talk to parents about how, as the child develops and their brain is growing,
Yes.
their ADHD may look different as well.
Mm.
That child that was super hyper may seem a bit calmer, but maybe their lack of focus, attention, organizational skills, all that is still there.
Mm.
So I think it's a matter of always partnering with your provider and reassessing things and being able to, if you note changes, keep a little notebook, keep a notebook, write things down, take that with you to the provider appointment, because it's very hard to remember everything when you
Yeah.
have that 30-minute appointment.
Mm.
Sometimes,
Yeah.
you walk out and you say, I forgot to tell them this, you know? And instead, just it's because some of these appointments may be every 3 months.
Yeah.
So, on that point, do not be afraid to call your provider for an earlier appointment. If
Mm.
there's something that's worrying you, do not wait until it's a week or two before exams or the second, third time teacher has already expressed concern.
Mm.
Reach out earlier, have that conversation. Um, so I think that would be my recommendation as far as the need. There is going to be a need for ongoing adjustments. It's not always a one and done scenario. I
Yeah.
have treated 5, 6, 7 year olds who've required the highest dose of stimulant.
Mm.
And then I've had teenagers that have been able to do well and navigate with just a middle of the road dose.
Mm.
So
Mm.
everyone is different.
Yeah, and then it doesn't mean if the child grows, the dosing will increase and etc. So it's individual, but also for a single child, symptoms and manifestation changes as well. And it's not one size fits all. So maybe parents should be prepared for that as well. Is that correct to say?
Yes,
Yeah.
yes,
All right. Okay.
absolutely. Yes.
Excellent. Excellent. So, I'd like to wrap up with a question. If there is one thing that you would like parents and listeners to take away from everything you said just now, what that would be?
I would say if you're questioning it, if you're concerned, seek out help. That is what we're here for. There is help available. That is the number one thing. I would like, if there's any question or thought that, hey, this might be ADHD, if you recognize it in yourself, if you recognize it in your child, if teachers or coaches are making any, or other relatives have made statements or comments that spark your concern, do not worry alone. Educate yourself and let providers help you and partner with you to support your child to be the best that they can be.
Excellent. Dr. Melendez, thank you so much. This was eye-opening. It was very informative, and I hope it was helpful to all parents out there who are maybe just starting on the ADHD journey with their child, or they are way into this, but maybe there is some new information that's useful to them. So thank you so much once again.
Absolutely. Thank you so much for inviting me.
No worries, you're very welcome, and we hope to have you again. So it's such a important topic and so much to explore with you. So we hope to have you back.
Okay, thank you.
Thank you for listening to Thriving with ADHD. This show is produced by Animo, Sano, Psychiatry. Please follow, rate, or share our podcast on Spotify, Apple Podcasts, or any other streaming app of your choice. Music is by Daddy's Music from Pixabay. For more information about Animo, Sano, Psychiatry, please visit animosanopsychiatry.com.